Alright, Chapter 7, Part 2. So now we're moving on to how we actually create the bone. So we already covered what makes the bone, and then we're going to now move on to how we actually create it. So the process of creating bone is called ossification or osteogenesis. Again, remembering that bone tissue is also called osseous tissue. So there's two ways to do this. Use either through intramembranous ossification. So this is how you produce your flat bones in the skull and the clavicle in the fetus. So flat bone from the skull cap on top of the skull, as well as the clavicle, which is our little shoulder bone that's up here, also called your collarbone. It's also how we thicken bones throughout the life. So of course, as child grows, bone's going to need to get bigger. And so they do it through intramembranous ossification. So intramembrane as in between the two membranes. So periosteum on the outside, endosteum on the inside. The other type of bone development is endochondral ossification. So that's how we lengthen bones. So first one, intramembranous ossification. So our bone tissue is made from the mesenchyme layer of the fetus. So we have our 3 layers of embryonic tissue, and our bone tissue is made from the mesenchyme layer. So eventually, over time, here in the red spaces, you have these very large blood vessels that become smaller and smaller as the development goes. So here, getting smaller and smaller, and actually zooming out now as well. Where as you're building the bone, so these mesenchymal cells will eventually become your osteoblasts, to eventually form more and more bone to become osteocytes. Then your spongy bone starts to develop, so becoming more and more structurally like the bone that we should see, where all these empty spaces are just now your marrow cavity. So instead of it being an actual blood vessel, it's just your bone marrow that's filled in those empty spaces. The spongy bone at this layer is only covered with periosteum. Actually, in this example, periosteum. Yeah, so periosteum here, there. So, sorry, misspoke on the earlier. So intramembranous between these two membranes. So 2 layers of periosteum. Eventually, continue to make these cavities smaller and smaller. So building more spongy bone, and then covering it with compact bone, so you have more osteoblasts underneath your periosteum, and starting to build up layers between the periosteum and the spongy bone to create your 2 layers of compact bone. So going back to our little model, little holes becoming smaller and smaller as you build more bone, eventually just being 2 layers of periosteum. Then eventually osteoblasts start building the compact bone to create your 2 layers of compact bone on the outside of your spongy bone. The other type of bone development is called endochondral ossification. So your infant bones, they start off as hyaline cartilage covered with our perichondrium. So this hyaline cartilage eventually is going to develop into our bone, and this is how we lengthen the bones. So you start off with what's this primary ossification center, where you have these chondrocytes that are going to continuously making what's cartilage tissue. So instead of osteocytes or osteoblasts, they're making cartilage. So cartilage is made by chondrocytes. So these chondrocytes are actually making more and more of this cartilage to eventually make a larger structure. So kind of, again, the infant bone. Eventually, you have blood vessels that start to integrate into it. So this little marrow cavity is formed in the center. Then you form this secondary ossification center, which eventually becomes the secondary marrow cavity with the blood vessel invading that space. Then you have these different zones of development for your for the length of the bone. So next section, again, we have enlarging of the cavities. Up top, we have the spongy bone covered with the compact bone, very large marrow cavity on the center of that bone. But the difference between our epiphyses and diaphyses, so remember our epiphyses is the enlarged area at the end of long bones. There's a gap in between that and the diaphyses, so the shaft portion. So there's this transitional area called the metaphysis, which is a bunch of different layers that transition from bone tissue to cartilage. So here in purple, covering the epiphyseal plate. So again, that area being filled with hyaline cartilage. And eventually you grow more and more bone. Again, this stays hyaline cartilage until you eventually grow into a full adult bone, where that epiphyseal plate or growth plate will fill in with bone and just becomes a bony scar to note where the growth plate was, and also it separates your epiphyses from your diaphyses. So with your endochondral ossification, so the lengthening of our bones, so during infancy and childhood, it's filled with the epiphyses, so those big enlarged heads are filled with spongy bone. And your cartilage for these bones is limited to the articular cartilage, so the cartilage that's only at joints, and the epiphyseal plate or growth plate, which is filled with the hyaline cartilage. So this serves as a growth zone for bone elongation, eventually by the late teens, early 20s. So for most of y'all, it's, the high time to give up your dreams to go into the NBA if you're kind of short and don't have the skills, but more so because you're kind of short, you're stuck. So no more growing for you. So this plate will harden over by this age, and instead of it being filled with hyaline cartilage, gets filled with bone. The primary and secondary marrow cavities will unite into one single cavity across the epiphyses and diaphyses, and again, can no longer grow in length, so you're done with trying to be taller than you started off at, taller than you are. Just showing the little fetal skeleton here. So in this image where you see it where it look kind of gappy, we're like, hey, we're missing some stuff. That's actually cartilage, and that's why you can't really see it. It's not as hard as bone, and so it doesn't come out as well in the image. So same thing up here, kind of baby soft spot where it's still growing together where those bones are, since you need this all to be smashed together so you can get the baby's head out without killing the mom. So all these kind of get smashed up and come through the birth canal, and then eventually harden into their full big head skull. So all these little gaps and spaces where it's cartilage is eventually going to form into your bone. So once your kid is born, of course your kid's going to get taller and larger. So this is again done at that epiphyseal plate, so that's your growth plate. And again, that growth plate has the hyaline cartilage in the middle. And then on the outside are your transitional zones that transition from cartilage into fully being replaced by bone. So this is called interstitial growth or growth from within. So the bone elongation is due to cartilage growth within the epiphyseal plate. And then once that cartilage is gone, then your bones are done growing. So your lengthwise growth is finished. So you can still grow your bones outward. You're just done growing them lengthwise. So in order to grow them wider, it's called appositional growth. So inside the periosteum that covers the outside surface of your bone, you have osteoblasts on the inside lining of that. And those osteoblasts will continue to build bone, and it's going to make the bones wider. So eventually, osteoblasts, so getting trapped in the lacuna as the tissue calcifies. So these osteoblasts will lay down matrix in layers that are parallel to the surface. So again, running through here. So it helps to widen the bones and to form your circumferential laminae. And on the inside, you have osteoclast. So our bone dissolving cells to help enlarge in the marrow cavity. So make that larger, make it more able to hold your bone marrow. So for example, as a kid grows older, needing more blood cells to be produced, so more of your red blood cells, your white blood cells, more platelets. So widening it from the outside, but also making more room for bone marrow on the inside, done by your osteoclast. So both our osteoblasts, our builder cells, and our osteoclasts are part of our bone remodeling. So with bone remodeling, you have absorption done by your osteoclast, and deposition or depositing bone done by your osteoblast. So our bone is actually remodeled, actually about 10% of the skeleton per year. So to help repair different microfractures, releasing minerals into the blood, so taking the calcium from your blood, from your bones, if you need it to be released. So for example, kind of bug you about, drinking your milk or not, your body's going to steal the calcium from your bones. Literally, it does so. Also helps to reshape the bones in response to use and disuse. So depending on, for example, your levels of activity, if you become heavier and so your bones need to support more weight, you're going to have bone remodeling to make sure that you're supporting it. So again, this is determined by mechanical stresses, and your osteoblasts and osteoclasts do so. So again, blasts are our builder cells, clasts are the ones that are going to dissolve bone. So again, your bones will grow larger in response to stress or pressure that is put on them. So your bones just don't sit in your body and just kind of support your body and protect your organs. It's actually a very metabolically active organ. So again, it does its own maintenance and growth with the osteoblasts and osteoclasts. It helps to exchange minerals with tissue fluid, so acts like a mineral bank. So when you need to reduce the level of calcium in the blood, then your osteoblasts are either increased in number or their activity is increased, so it takes calcium out of the blood and helps to store that in the bone. If you have a disturbance in your calcium homeostasis, so keeping your levels the way they should, it actually disrupts other organs. So for example, your nervous tissue using calcium as part of their final step to signal to other cells. And with your muscular system, the muscular system needing calcium in order to make the contractions necessary. So that's chapter 11, I think, or 10. So with these two systems, make sure you're having the necessary amount of calcium allows them to continue to do their job. So with the process of building bone, your osteoblasts are going to make your collagen fibers, and then those collagen fibers will have minerals that are deposited onto them to go through the mineralization process. So the minerals are encrusted with hydroxyapatite crystals. These C crystals will attract more calcium and phosphate to allow the collagen fibers that were laid down to become more mineralized and to build up the bone. The opposite case, so our bone resorption done by our osteoclasts. So with our osteoclasts, so they're sitting in that resorption bay. So here's a simplified osteoclast here, gray being the resorption bay. So it pumps out hydrogen into the resorption bay. Then you have chloride, which is the chloride ion, which is negative, and so it's electrically attracted to the positive hydrogen ion. That chloride ion just freely flows out of the cell, combining with hydrogen to form hydrochloric acid, so a very strong acid. And also flowing osmotically is water, so produce that whole solution. So when this solution happens of the hydrochloric acid and being put in the water, helps to dissolve the bone, so helps to make a bigger hole or bigger reabsorption bay. So when those minerals are dissolved by the hydrochloric acid, what the minerals are taken away, what's exposed or what's left over is your collagen fibers, and your collagen fibers are digested by an acid protease. So again, ACE for enzyme, and they're breaking down the protein, and the protein that they're breaking down is the collagen one. So in order to help control your bone resorption and bone deposition, part of that is done through hormonal control to help maintain your particular levels of calcium. So there's 3 hormones that regulate your calcium homeostasis. That's calcitriol, calcitonin, and parathyroid hormone. So the first one is calcitriol. It's a form of vitamin D. So we start off in your epidermal keratinocytes, so in the skin, using UV radiation from the sun to convert one chemical to a pre-vitamin form of vitamin D. So another reason to excuse to get out and get some sun, so helping to make sure you have your vitamin D, because your vitamin D is necessary to absorb calcium from your diet. Anyway, next 2 steps. That's next steps taken in the liver, which does some stuff to that former pre-vitamin D. Then the kidney does the last step to convert it to the calcitriol, which is the actual active form. So I'm going to show you a chart at the end that goes through how each of these 3 hormones work. So I'm actually going to skip these. So here's just a picture showing skin and UV does the first step, liver does the second step, kidney does the last step, and it helps to regulate the calcium levels in your body through controlling your bone resorption, your excretion of your calcium from the kidneys, so how much is lost to urine, as well as how much can be absorbed by your digestion system from the food you eat. So the next one is your calcitriol, necessary for bone deposition, helps to provide adequate calcium and phosphate. Sorry, that's the first one. Second one is calcitonin. Helps to lower your blood calcium concentration through inhibiting your osteoclast and stimulating your osteoblast. So it works on a negative feedback loop to adjust for your blood calcium levels. So it's going to reduce your blood calcium levels. So again, too much calcium, calcitonin is secreted, reducing your osteoclast, so less bone is resorbed, so less bone is dissolved, and less of its calcium is released into the blood. Then secondly, through increasing your osteoblast, so those builder cells are going to deposit more bone onto your skeleton, and by doing so, they're going to take calcium from the blood and therefore reducing your calcium levels. Last one is parathyroid hormone. So its job is to raise calcium blood levels by increasing your osteoclast. So more osteoclast, more bone dissolving, and therefore releasing calcium into the blood. Helps to promote calcium reabsorption by the kidneys, so less of it's lost during urine, and it helps to enhance the effect of calcitriol. So calcitriol also raises your blood calcium levels. Then lastly, it also inhibits collagen synthesis by your osteoblast. So again, less building of your bone, less calcium is being taken away from your blood, and so therefore raising your blood calcium levels. So still another negative feedback level, decreased blood calcium level, causing parathyroid hormone to be secreted, causing all these different effects to eventually return your blood calcium levels to normal. So this chart just has how they all work together on different organ and organ systems to adjust your blood calcium levels. The next major mineral that's part of your bone is your phosphate. So only 2 of those hormones affect it. So calcitriol helps to raise your phosphate level by promoting absorption in the small intestines, and parathyroid hormone lowers your blood phosphate levels by promoting urinary excretion. So more is lost to urine. So here's a little chart I was going to show you. So each of your 3 hormones are located here. So calcitriol, starting in skin, then liver, then kidney, raises our blood calcium levels through these different effects. So increased absorption, increased small intestine absorption, so more from the diet, increased bone resorption, and then less is lost to urine. Its effect on phosphate, so increasing phosphate levels by increasing absorption from the small intestines. Calcitonin, made in the thyroid gland, increases our blood calcium level by inhibiting osteoclasts and stimulating osteoblasts. It does not have an effect on phosphate levels. Last one, parathyroid hormone, increases blood calcium levels by increasing the number of osteoclasts, increasing reabsorption of calcium in the kidney, so less is lost to urine, increasing the effect of calcitriol, so helping this guy out, and inhibiting your osteoblasts, so less bone building. Its effect on phosphate, so it has the opposite effect, decrease phosphate levels by increasing urinary excretion, or by basically more is lost through urine. Now moving on to chapter 8, which is the skeletal system, so just looking at the bones individually themselves. So your skeletal system is set up into 2 major categories. You have your axial skeleton, so just like your axial region of the body that we learned from chapter 1. So the stuff that's on the center part, so not your arm and legs. So the bones that make up your axial skeleton, so we're doing very generic. You have your skull, vertebrae, sternum, and your ribs, as well as the hyoid bone, which is not shown here, but it's just in your throat region. The appendicular skeleton is the bones that make up your appendages. So your scapula, your collarbone, which is also called your clavicle, your humerus, so here and here, radius and ulna, your carpal bones and your metacarpal bones, and your phalanges, your os coxa, which is also your hip bone. You got the femur and your thigh, the patella, then your tibia and fibula, the little tiny one on the outside, tarsal bones, as well as your metatarsals and phalanges. Inside the adult skeleton, there are 206 bones. Don't worry, you don't have to know all of those for the bone exam. That's why you have the study guide. This varies depending on the person, so not only their bone development, but sometimes you have maybe an less vertebrae than a normal person, but it's okay because your body still functions the way it should. One variation, it's kind of a cool one, are these sutural, or also called wormian bones inside the skull. So here's a picture of it where instead of a normal development of these sutures at the top of the skull, so remember when I showed you the picture of the infant skeleton where some of that bone is missing, so of course needing hold, squish the head so you can get out the birth canal. When these bones fuse together, sometimes they don't fuse just in their pretty little lines. Sometimes an island of bone develops in the middle of those suture lines. So all of this is still sutured together at these different bony joints. But these little islands of bones are called wormian bones or sutural bones. So something you have to know for the bone exam, by the way. So there's different types of bone markings. So basically little shapes on the bones that allows for different things to do. So either holes that come through, articular surfaces where there's joints, pores and slits for allowing spaces for stuff, ridges and spines, bumps and depressions, so where you have attachment points. So there's 2 different ways to study a bone. You can do it through an articulated skeleton. So like this guy, where all the bones are stuck together so you can actually see their relationships with each other. The other way is through a disarticulated skeleton, so where the skeleton is in separate parts. So one thing I would suggest for you guys, of course we have our disarticulated skeleton inside in the lab. It's going to be placed out. But what you can do is go to like a craft store or maybe Walmart, even the craft store might be a little bit more detailed, and get you a little cheap decoration type of skeleton, and if you need to, for example, this one, you know, some of the details aren't as good. For example, on this femur, wish it were a little bit more detailed, but fairly detailed for the vertebrae, which is kind of cool. So you can actually take a Sharpie if you want to and be able to mark on it. Again, it's cheap, so why not? To either label or like make your own little markings to denote, hey, there should be something here that I need to make sure I know to name. So for example, I got this skeleton at at least the skull at Michael's. Yeah, Michael's. So it actually has a lot of the names already on there, like parietal bone, frontal bone. You just have to make sure that they're exact same name. So like, for example, this one says malar. But that's just another way of saying the zygomatic bone. So again, you have to pay attention to, you know, it's decoration. So it might not be exactly how it's supposed to be. Of course, you have different things on here that have extra parts that you're going to have to name. So you might want to take a little Sharpie and just draw on the bone so that you can have the specifics on your bone. So yeah. Again, another thing, upper jawbone, lower jawbone, actually has real names. So maxilla and mandible. So again, Sharpie right all over it. Okay, so there's very different anatomical features of bone. These will help as you know how they're described. So as you're studying the bone, you have all these features you're trying to remember. Knowing the definition of them helps you to know, to kind of remember, it's like, okay, wait, which one is that one again? And be able to correctly name what you're supposed to. So at a joint, you have different features. For example, a condyle, which is a round knob. A facet is some kind of smooth surface, and a head is a prominent extension. So condyles here, and these little facets here. Extensions and projections, so you have a crest, which is a narrow ridge here on the femur. An epicondyle, so on the outside of the condyles. A line or a raised ridge. A process, which is a bony extension. And a protuberance is a bony outgrowth. Still on extensions and projections, you have a spine, so it's very thin type of projection. The trochanter, which is only on the femur, so these look extensions outward. A tubercle, which is a small bulge, so on your humerus, on your upper arm region. And a tuberosity, which is a rough surface. So right here on this edge, it's kind of rough. Now moving to depressions, so dips in the bone. So you have alveolus, which is a pit or a socket. So for example, your socket for your teeth. A fossa, which is a shallow basin. A fovea, so tip of your femur head in that little rounded head of the femur. The fovea capitis there. And then a sulcus is a little small groove. Now moving to passages and cavities, so places or openings for stuff. So canal is a tube or opening. So for example, your hypoglossal canal allows for a nerve to pass through. A fissure is a thin slit or opening, so allowing for different attachments for your eye as well as nerves going from your eye back in towards your brain. A foramen is a hole on your skull. A canal, a meatus is a canal, so canal for your, like for example, your ear canal goes through there. And then a sinus is a air-filled space, so this actually helps your skull not weigh so much. Okay, so that's the end of our exam 2 material. So again, hit up the study guide, answer those questions, and that way that can help you to focus just on what's necessary for the exam.